So welcome everybody, thanks for joining us today. My name is Belinda Kippen and I'm the team leader at Women's Health Queensland-wide in the Health Education Program area. So a little bit about Women's Health. We're specialists in women's health and we support women from the southeast of Queensland right up to the far north around decision making for their health and wellbeing. Today, we've got Lisa Peberdy with us, who is the Cervical Clinical Nurse Consultant at the Queensland Department of Health. And as you know, the cervical screening test for Australian women will be introduced in December this year and will replace pap smears. In the lead up to its introduction, it's understandable that many women and health professionals have lots of important questions. So we're really delighted to have Lisa here, and we're going to pick her brain and throw a few curly questions at her. And you are all welcome to ask questions along the way, and they will come up on our screen, and we'll allocate some time at the end of the presentation to answer all the questions. So we might get started. So welcome, Lisa. Thanks for joining us today.
Oh, thank you for inviting me, Belinda. It's a pleasure to be here.
Lovely.
A nice way to start a Tuesday morning.
Yes, it is. Okay, so what does cervical screening mean?
Well, I suppose to Australian women, what cervical screening means is having your regular two-yearly pap smear. To pick up any small changes of the cervix which could lead to cervical cancer in the future.
And so why are things changing in Australia? Why is there a change from the way we've done things up until now to an entirely different way of screening?
Essentially, it's because of new evidence that has come to light with how cervical cancer actually progresses, and also because of the introduction of the HPV vaccine to school-aged girls.
And so, Lisa, what are the changes? I know there's a bit of confusion out there. People aren't quite sure what the changes are and what they mean to them as women on a day-to-day basis.
Oh, okay then. Well, for the last 26 years, I suppose, since 1991, all women who've ever been sexually active between the ages of 20 to 69 have had to have a two-yearly pap smear test. But now that's changing, where it'll go to 5-yearly, and it will be called a cervical screening test, and we won't have to start having those cervical screening tests until we're 25.
Oh wow, that's a big difference.
Yeah, it is actually. And then women can decide to stop having these cervical screening tests from the age of 70 to 74 years of age.
And so 5-yearly screening, that's going to make a big difference, I guess, to how many times women actually have to have the procedure. So I imagine in a woman's lifetime, previously, maybe you'd have about 26 pap tests.
That's right.
Whereas if you're having a 5-yearly screening test, it probably down to something around about 10. Would that be right?
Yeah, that's right. Only about 10 times in our life.
So that's a good thing.
It is very much a good thing. Yeah.
I mean, many women we speak to, it can be quite an anxiety-provoked time going and having a pap smear and going to the doctor and having a special examination. So less of those is great.
That's right. And we all lead increasingly busy lives these days. And so even though the procedure is only about 15 minutes, it's 15 minutes, and we've got to try and find that in our day-to-day lives. I mean, most of us are working, and then of course, we've all got menstrual cycles, so we're dodging that, we're dodging family commitments. Yeah, so only having to go 10 times in your life, I think that will make it it will a lot easier for women to actually participate and have regular screening.
That's right. It takes away that's one less barrier, I guess.
That's right.
Having less tests. Okay, so to the nitty-gritty. So what are the changes?
Yeah. What are the changes? Okay then. So the main changes, I suppose, is that it's going from a 2-yearly pap smear to a 5-yearly cervical screening test. Whereas with the pap test, we were actually looking for any early changes of the cervical cells that could become cervical cancer. But now with the cervical screening tests, we're actually looking to detect the HPV virus, which we know is responsible for the majority of cervical cancers.
And so, if I hear you correctly, previously we were looking for changes to the cells.
Yes.
And now we're looking for the virus.
That's right. So we're looking for the virus that actually causes the changes.
And so, and that's the human papilloma virus, otherwise known as HPV.
Yeah.
So what is HPV?
HPV? Look, it's a very, very common virus that the majority of us will come in contact with during our lifetime. It is a sexually transmitted virus. It's passed on through skin-to-skin contact, and it's been referred to as the common cold of sexual activity.
Oh, yeah.
So, you know,
yeah,
that's right. So, like, if you've ever been sexually active, there is that chance that you have come in
contact. Be exposed.
Yes, that's right. Yeah.
And so, can we protect ourselves against the HPV virus with condoms and?
Well, the first line of protection, of course, is the HPV vaccine, which is being offered to school-age girls and also school-age boys as well. So that's the very first line, and that protects at this point in time against approximately 70% of the viruses that can lead to cervical cancer. But then, you know, you can use condoms as well to help protect, but they're not as effective because it's any sort of skin-to-skin contact. So, you know, they do protect, but it's not 100% protection.
Okay. Yeah. And so if we're sexually active, we're more than likely going to be exposed to the HPV virus.
That's right.
And the best way of protecting ourselves is through screening.
Yep, through vaccination. Vaccination is our first line of protection against developing cervical cancer, and then, of course, screening is our secondary.
Okay, so how will this cervical screening test improve detection? Because I've heard that it is a superior test, and it's actually going to pick up more possible changes or...
Well, it's a lot more sensitive.
Okay.
So I think that's the most important thing, is it is a lot more sensitive. It's going to pick up the HPV virus.
Yep.
If a woman has the HPV virus, and that those women who it's been identified do have the HPV virus, they will be watched a lot closer. But see, with the HPV viruses that are implicated in the development of cervical cancer, it's persistent. See, the majority of us, we will come in contact with the HPV virus, but because of our immune systems, we will clear it. But it's those cases of HPV that we don't clear and they're persistent and they continue to be there. They're the ones that cause the trouble and cause the cervical changes, which then lead on to cervical cancer.
Okay, so, and again, as you said before, the biggest change here is that we're actually looking for the virus before
the cell changes. Whereas with the conventional pap smear test that we've been having for the last 26 years, what it was looking for was any cervical cell changes. But this one is actually going to be looking for the viruses that actually causes the cell change.
Okay. And so what happens if I go and have a cervical screening test and it shows that I do have the virus? So what happens then? Where do I go next?
Okay, then. Well, it just depends which viruses they pick up, because there are different viruses. But essentially, what they'll be doing when they do the pap smear, so it's the cervical screening test, it's similar to what happens now. We have the internal examination, and the healthcare professional will take a small sample of the cells from the cervix. Okay. So the very first thing they do when they test that sample of cells is they're looking for the actual virus. If they detect the virus, then they look at the cells to see if there's any small changes or any changes at all. So it just depends whether there's any cell changes as to what the process is then. But if they do pick up the HPV virus, then they will just watch you a lot closer.
Oh, okay. So it might mean I have to have more regular
That's right.
tests.
You may just have to have it repeated in 12 months to see if you've actually cleared that virus, or you may have to go and have a procedure called colposcopy, which is very similar to having a cervical screening test. It's just where they look at the cervix with a microscope to actually see the extent of the cell changes.
And Lisa, and I think you touched on this before, many times our bodies will just clear the virus.
That's right.
On its own. So this 5-yearly screening gives our bodies a chance to actually do that.
That's exactly right.
So we're not doing unnecessary treatments or tests. Along the way.
Exactly. With the 2-yearly Pap test, like you would often pick up the virus and the cell changes, but they may have cleared.
If you let things alone.
That's exactly right. So with the 5-yearly test, I mean, you may come in contact with the HPV virus, but actually clear it. So if that is the case, you will just continue to have 5-yearly tests.
Great.
Whereas before, if they picked up the changes, then there would be treatment, and some of those treatments have been shown to cause pregnancy complications.
So
it's better to avoid all of that. And just this unnecessary treatment that your body would have naturally cleared the infection.
Right. Okay. So I'm just getting my pages. I've heard there's been quite a lot of women concerned, I guess, about the change, and there has been some people saying, is it just about the government saving money? Are the changes from 2 to 5 years really just a cost-cutting measure?
Definitely not. No, I mean, it's because of the new evidence, and actually the cervical screening test is going to be a little bit more expensive for the government. So, we just don't have to do it as often. So it's certainly
nothing to do
with
so it's really important we just get that message out there about what it is and why the change is happening and what it means for women.
Well, that's it. We've got new evidence. We've got the HPV vaccine, so we're seeing less and less young women having cervical abnormalities now as a result. So, but definitely cost cutting was never brought into the equation.
Okay, and so I know that another question that is of concern for some women is that will young women miss out on early detection if testing doesn't start till 25?
No, because cervical cancer is very, very rare in women under the age of 25. And since we've been screening for the last 26 years, we haven't picked up more cases, or there haven't been less deaths from cervical cancer in women of that age group. So, no. But of course, if any women under the age of 25 have any unusual symptoms such as bleeding between their periods, bleeding after sexual intercourse, or any pain or discharge, they are advised to go and see the healthcare professional, and they can have what we call the co-test. So they will still be able to have the cervical screening test as part of a workup to see what that bleeding is about.
And so, Lisa, that are all the sort of formal questions that I had. Is there anything else that we haven't touched on that you think you might like to add at this point before we go to questions that people have posted?
No, I think we've covered the major points. So really, just if anyone's got any questions that they'd like to ask, this is the opportunity to ask those questions.
Okay, so let's go and have a look. So someone has asked a question about self-testing. So I know there's a bit of confusion around this. So let's sort of explore that. So
okay, then the self-testing. There's been a lot in the media, and we've certainly had quite a few calls about the self-testing. And yes, that is an option, but really self-testing is being offered to those women who are overdue their cervical screening and really do not want to have the internal examination, and they must be over 30. Yes, over 30.
So
and 2 years overdue.
And I've heard that it's sort of the women that are under-screened. So typically the ones that are finding it very difficult to go and have a pap smear. So it's a way of trying to
encourage them to be screened, because all the evidence has shown that 80% of women who develop cervical cancer have never been screened or are under-screened, so have not been having regular screening. So this is one way to...
So it's one way to encourage
to screen, so to prevent these women from developing cervical cancer. And I know one of the misconceptions out there is that they can buy the cervical screening self-test at a chemist or online, and they can do it at home, and then they send it off somewhere else.
And that's not the case.
No, that's not the test. With the self-collection is you still need to go and see your healthcare professional. You have to meet that criteria that you're overdue, and you just refuse to have an internal examination for the healthcare professional to collect the cells. And so the healthcare professional will explain exactly how to do the test, and you do it there in the clinic room.
Okay, so it's not go and buy it over the counter at the chemist, do a quick test, send it off. That's certainly not an option available to women. It's really for those group of women that haven't been screened, have found it difficult to go and have a pap smear. So it's trying to get that cohort of women who've been under-screened.
That's right.
And they're the ones that typically tend to develop cervical cancer over time.
Yeah, that's right. So, and with the self-collection test, if it does show up that that's high risk or HPV high risk positive, those women still need to come back and have a healthcare professional take another sample of cells from the cervix, so the cells then can be examined to see if there's any abnormality. So it's not the get out of jail card. And I think that's what a lot of the misconceptions are, is that you will never have to have an examination. So it's just that first step, so that we can identify those women.
There are some women that find it difficult to come and have an examination, so for those women there is an option of a self-test, but you still have to go to the GP.
Yes, you have to go to your healthcare professional, whether it's your women's health nurse or whether it's your GP, and you can do the self-collect there in the clinical environment. But if it does pick up the HPV virus, well then they will need to come back, and we do need to then do another sample of cells from the cervix.
Great, okay. All right. Just bear with me while I have a look at these questions. So this is from Ruth, and Ruth asks, will the pathway to management of abnormal cells change? L-cell and high-cell no longer to be the pathway schedule for follow-up?
The follow-up will change, and the management of any abnormalities will change, but I don't think this really is the forum to discuss it, and it's certainly something that they should discuss with their healthcare professional, whether it's their women's health nurse or their GP.
Okay. And then there's Julie, who's a pap smear nurse, and she's wondering if the sample taking will be the same.
The sample taking will be exactly the same, so the woman still has the internal examination where they put a speculum into the vagina and they locate the cervix, and then it's really important that they collect the cells from the transformation zone of the cervix, so the correct area of the cervix, to make sure that they get the correct cells. So everything stays the same. What does change is that instead of then putting the cells onto a glass slide, the cells are actually put into a little vial of fluid. So the brush is actually put into a vial of fluid, and that is what is sent off to the pathologist. So, and with that vial, that's where they can test it for HPV first, and then they can retest the cells in that vial for any cellular abnormalities, and that's what they can't do with the self-collect, because it's a dry test, so they'll just be testing it for HPV. They won't be able to test those cells then for any cellular abnormality.
And someone has just had trouble dialing in and wants us to just go over the new evidence again. So we just recap on, I guess, the background around why we're changing.
Okay, we're changing because what we know now is that HPV is essential for the development of cervical cancer. So if you don't have HPV, the chances of developing cervical cancer are very, very low. So that is the most important thing. So that is why we're testing first for the HPV virus and the persistence of it. So as I said earlier, that the majority of us will come in contact with the HPV virus and we will have it at some point in our life. But because of our immune systems, we clear it and no further problems. But it's in those women where their bodies don't clear the virus and it stays there.
It's persistent.
It's persistent, and that's when it causes the cell changes.
Okay, great. So there's a question here, I think we've covered it, about self-testing from Sasha. If they, oh no, it's not self-testing, if they test positive for HPV, how often is the follow-up? And I think we touched on
look,
that
essentially, if they
they
do test positive to one of the worrisome HPV viruses, they will, it just depends which ones.
Yes.
Okay, so if it is the 16 and 18,
yes,
which cause the majority of the cervical cancers, or associated with the majority of the cervical cancers, they will then need to have what we call colposcopy, where the cervix is looked at under a microscope. If it's one of the other high-risk HPV viruses, they will just need to have a repeat HPV test in 12 months' time.
And when does your screening go back to the 5-yearly?
Once you've cleared the virus.
Once the virus is gone?
Yes, exactly. Okay. Once you've proven you've had 2 HPV tests and the virus is cleared, then you can go back to the 5-yearly.
Okay, so, you know, if you have your test and it's HPV positive and it's one of the high-risk types, you might have to go and have a colposcopy, which is where they have a closer look. It's like a pap smear, but with a closer look at the cervix to examine the cells to see if there's any changes to the cells.
That's exactly right. Yes. And if there's quite high-grade changes, they'll remove that area, that group of cells, and then you'll have closer follow-up until your tests come back that you're negative to HPV.
Not unlike the current.
Exactly,
guidelines.
Not unlike that.
And so then just recapping too, if I have a HPV positive result, and it's not it's not 16 or 18, it's one of the other high risk ones, they will just recommend that I come back for another test in 12 months' time.
That's exactly right. Okay. Yeah. So, and then when you return in 12 months' time, if it's still positive, that's when you will then have the colposcopy, and they'll just see if there is anything actually happening with those cervical cells.
Okay. Lots of people having some technical difficulties. I'm really sorry. I'll just see if we've got any other questions. Oh, where are my questions gone? I had a couple of questions I thought I might throw at you too.
Okay.
Lisa.
I have no curly hard ones.
Yeah. So, okay. So this is my pretend patient.
Okay.
And she's 23 years old.
Yes.
And she's already started having pap smears. And she's due for one when she's 24. What will happen?
So that's next year?
Yeah.
Okay then. Well, the new changes are scheduled to come in as of the 1st of December this year.
Yep.
So if her pap smears have all been negative, she will receive a letter from the new National Cancer Screening Register, and they will advise her of the changes, and they will also advise that they'll be sending her an invitation to have her next pap smear after her 25th birthday, around the time of her 25th birthday. Okay. If she's had some abnormalities in the past and she's currently being managed for those abnormalities, then she will continue as per the recommendations.
Okay, so she will be recommended not to have a screen till she's 25.
Yeah, till she's 25. If she's had normal history, all her pap smears have been fine.
Right.
Yeah, that's exactly right. So,
and how, is there anything else that you want to, I guess, talk about in terms of that transition into screening? So what will happen? So women are going to get a letter? Or?
Yes, when the new screening starts on the 1st of December, it'll be starting at the same time as the new National Cancer Screening Register. Yes. So the National Cancer Screening Register will be sending an invitation to all women aged between 25 and 74 to invite them to come and have when their next pap smear is due, or cervical screening test. I must get my head around calling it the cervical screening test. So the register will invite them and let them know when they're next due.
Okay, and I think you say an important thing, getting the language right.
Because for so long we've all been calling it the pap test, but now it's being called the cervical screening test, which is far more, I suppose, accurate when you think about it. That's what the pap test has been, is it's about cervical screening.
That's right.
So by calling it the cervical screening test, it makes far more sense.
It's about the cervix.
That's exactly right. We call breast screening.
That's right. Yeah.
We call the bowel screening. So why not call cervical screening? Cervical screening.
Yeah. Okay. All right. I had another one. Okay. So this is Mona.
Yes.
If I have the vaccine, do I really need to have this cervical screening?
You do. Yeah. Because at the moment the current vaccination only protects against approximately 70% of the HPV viruses that are linked to cervical cancer. So yes, this new cervical screening regime is for women who are both vaccinated and unvaccinated.
Okay, and I guess over time we're going to see less and less incidents.
We
already are.
Yeah, we are. Like the HPV vaccine, I think, has been around since 2006, so it's been around for 10 years, and we are seeing a great reduction in the number of young women who have been vaccinated having high-grade abnormalities. So that way we know the vaccine is actually working.
And I'm probably putting you on the spot here, but so the two high-risk HPV viruses that the vaccine covers are 16 and 18.
Yes.
And so what percentage are they of the HPV viruses?
Oh, look, you have put me on the spot. I used to know this. I think it's about 60%.
Wow, okay. So there's 40% of other nasties out there that you could potentially be exposed to, and that's why it's important to continue with your screening.
Yeah, that's exactly right. Yeah. So at the moment, the HPV vaccine, it covers the 16 and 18 strand, and then there's two other strands that it covers that are responsible for the external genital warts. So, and there is a new 9-strain HPV vaccine, that will be, I suppose, implemented in the next couple of years, and that's going to cover 9 strains. So that
greater protection.
That's exactly right. Yeah. So in a few years' time, there'll be even greater protection against the HPV virus.
Okay, I've got one more of my questions.
Okay.
So Tracy asks, I've heard I don't have to have an examination anymore when I have my pap smear. Is that true? We've covered that, haven't we? Do you want to go over that again?
Yeah, I will, because once again, there's been a lot of misunderstanding out there with the change from a pap test to a cervical screening test, that women won't have to have the internal examination, and that's not true.
But the good news is, over your lifetime, you have less.
That's right, from about 26 down to 10. So, but yes, you still do need to have that examination. Yeah.
And it's about finding a provider that you feel comfortable
with. Yeah, that's right.
And at Women's Health Queensland wide too, you can always call us and speak to one of the nurses. If you're looking to find a pap smear provider, we have a database of services where we can look for nurses and GPs in your location that do pap smears. So please give us a call if you're looking for a pap smear or cervical screening.
Yeah, the cervical screening
provider.
Test. Yeah.
Okay, let's see if there's any other questions. I'll just go back up to the top. I might have missed some. And apologies to people that have had some technical difficulties.
Luckily it's being taped, so then it can be edited and put on the website afterwards. So sorry everyone who can't hear or having trouble.
Okay. There are some more here that I didn't have. So if a woman has previously shown abnormal cells but no HPV, can she still choose to have cell examination also? That sounds like a complicated question.
Yeah, so they've had abnormal cells but no HPV. I think that would be something you would need to talk to your GP about.
Okay.
Yeah,
So a bit tricky.
Yeah, that is.
And I guess there are going to be case by case sort of examples where you'll have to examine them more closely.
That's right. Yeah, there will be the individual cases. Yeah, not everyone sort of fits into one box. So
okay.
yeah.
Right. Okay, so this is a question about a cost. Will the liquid-based testing cost the woman anything?
No, it won't. As of the 1st of December, it will be replacing the conventional cytology slide. So it will be bulk billed. So all the pathology labs will be bulk billing it. Yeah. But as to actually having the examination done, I suppose that would be up to your individual GP practice.
So
whether
women still need to check with their provider what the cost of the procedure is going to be.
The consult, I suppose, because the actual pap smear, the cervical screening test will be bulk billed by the pathologist, so there won't be any costs involved. But as to whether the consultation is bulk billed or whether they have to pay for that is up to each individual practice, I suppose. Whereas, presently, the conventional slide is bulk billed by pathology companies, and the government covers that cost. Okay. But if women choose to have the liquid-based test, which is what is going to be the standard test after the 1st of December, at the moment women have to pay for that.
Okay, and they won't?
No, that will actually be...
That's good to clear that up.
Yeah, so there will be no cost to actually have that.
Okay, and there was another part to that question too. Is there a likelihood that it could yield unsatisfactory results or be affected by atrophic changes in older women?
Yes, there can be unsatisfactory results. Yeah. So it would be pretty rare, and the woman would just have to come back and have that repeated.
So similar to previous.
Yeah, exactly. And with the atrophic changes, we won't know unless the woman tests positive for HPV, because unless a woman tests positive for HPV and is asymptomatic, so no unusual vaginal bleeding at all, there will be no need to actually look at the cells. And it's when we look at the cells that we see the atrophic changes. So you see that a lot more now. Yes. A lot more women are being recalled, especially postmenopausal women tend to have atrophic cervical cells. So they're being recalled, now quite often to have it repeated after having some local estrogen.
So you're saying now that you can pick up the HPV even though perhaps you haven't got the cells from the transformation zone. Is that what you're saying?
Yes, because if the HPV is affecting the cells.
Okay.
Yeah, but we really, with the self-collect, that's where, when you self-collect, you don't know whether you're actually hitting the cervix. So that's why if it does pick up HPV, the women do need to come back and have an examination to make sure that the right cells are collected from the right area of the cervix. Whereas at the moment, when it's collected by the clinician is actually identifying the cervix, identifying the correct area of the cervix, and then collecting the cells so we know they're getting the right cells.
And can I just clarify, just for my own thoughts, the older woman who goes and has a cervical screening test and comes back with positive HPV changes, but then they go on to look at the cellular level and they haven't got the cells from the transformation zone. What happens to that woman? What's the recommendation?
I'm not quite sure, but I'm assuming they may have to go on to have the either a repeat sample or a colposcopy. So
maybe similar to now. So for those who aren't often, they might have to have some estrogen treatment for a couple of weeks.
You only need to have the estrogen treatment for a couple of weeks and repeated if the cells are atrophic, because at the moment with the conventional pap smear, when they're atrophic, they're very difficult to actually determine whether the cells are just atrophic or whether there is an abnormality. So that is why we get women to come back after having local...
And when you say atrophic, you mean sort of small and
they're a little bit shriveled up. So they're just more difficult to read. So, but if a woman's cells do look like they've got atrophic changes and the pathologist isn't quite sure, once they have the local estrogen, they pop back nicely, nice, fresh, and like young cells. So, and then they can actually say, yes, it was atrophic changes, no abnormalities detected. So, yes.
So similar with the new cervical screening?
Well, I suppose what we're going in and we're looking for is the HPV virus. Okay. So if the HPV virus is not there and they're asymptomatic, they're not having any unusual bleeding, okay, there's no need to check those cells.
Right.
Okay. So we may never know. So say you're 62, you may have atrophic cells, but you are not testing positive for HPV.
Yep, so that's fine.
Yeah, so you won't have to come back. Yep. Yeah, whereas now, if you're that same age and you've got atrophic cells, you have to come back and have it repeated and the rest of it. Yeah.
Okay, great. I think that answers that question there. If we might have answered this, if the woman tests positive for HPV, what is the follow-up schedule screening? We've done that. How does
it just depends on what type of HPV. And it's either they will go on to have a colposcopy or they will just have a repeat HPV in 12 months. It just depends.
And here's one about volt smearing. So how does this new test work for volt smear testing?
The same as the...
and if we just clarify for people out there who perhaps aren't nurses or medical practitioners what we mean by volt smear?
Volt smear is a woman who's had a hysterectomy and she's had her uterus and her cervix removed, so she doesn't have a cervix. This is just at the end of the vagina is just a suture.
And she needs to continue having screening because perhaps she's had a hysterectomy because of cancer?
Because of malignant reasons.
Right.
So, and like if she has in the past had malignant changes, well then it would be the same. The test would be done the same, just along the volt line.
Okay. But once again, the answer to the question is, how does the new test work for volt smear? It's the same.
It's exactly the same, but really each woman who has had a hysterectomy needs to talk to her GP or healthcare provider to see whether she does need to continue having. Okay.
Okay, women will cycle through the cervical screening test when they are due for the next pap smear. So
that's exactly right. So say you're the new testing regime comes in on the 1st of December. Say you're due in November this year. Okay, you still have your pap smear in November this year, and because you'll be having the cytology test, okay, you will be recalled in 2 years' time, November 2 years' time, if all's normal and all's natural. And then you will start your first HP or your first cervical screening test.
In that 2 year time.
Okay. Whereas if you're due for your next pap smear December 12 this year, you will actually be you'll be starting to have the new cervical screening test, and if all's normal, well then you would come back in 5 years' time. But we strongly recommend that women don't defer until...
So just continue
if you're due
normal schedule
up until December to have your pap smear, to go along and have it when it's due.
And good advice. Oops. See if there's any more. Okay. Will there be new brochures for cervical screening test abnormal result booklets be produced by the National Cancer Screening Program?
Yes.
Because I know in the past we've used that beautiful green brochure that says, so you're having a pap smear or so you've had an abnormal result, and it's a great resource for women in very simple language, so you're planning to produce a similar result?
Yes, the Commonwealth are actually producing those at the moment.
Great.
So, and they will be released hopefully in the next couple of months. They'll be available, and there will also be information packs for healthcare professionals and cervical screening healthcare professionals, and it will go through all the recommendations, all the screening intervals, and it will have an example of all the available resources for women. And they have developed all the consumer resources in 12 different languages.
Oh, wow.
And they are the 12 most common languages in Australia.
Great. So that's being developed at the moment. So
yes, and they will all be available off the National Cancer Screening website.
Okay.
So, and they should be available in the next couple of months, well before the December 1 implementation.
Right.
Yeah.
Good to know. And I think that's all we have for questions. So I might just, I forgot the health journey.
I did have a copy of the health journey.
I just wanted to draw people's attention to Women's Health Queensland-wide's latest health journey. In there, we've got a great article on everything that we've spoken about today, just in a little bit more detail. So you can actually look at health journey on our website. So I encourage people to go online and download the health journey.
That's a really good resource. I was looking at that this morning, and it is a really.
It's just very simply written, and the questions,
all the most
we've
common
addressed are answered very, very, very easy to understand.
And it would be really good for people to have that in their practices, for women to be able to.
And if you are in a general practice, if you're for GPs and practice nurses, you can actually have the hard copy in your foyer. So please contact us if you'd like to have Health Journey delivered to you on a regular basis for your patients to have a look through. So I think that's probably everything. Nothing else that you need to add, Lisa?
I can't think of anything at the moment, but look, honestly, if anyone out there does have any more questions, to contact health information line.
So please contact us on the health information line. I'll give out the number. So we have registered nurses and midwives who are available to talk with women about any particular issue or question they have, and that number is 3216 0376, or if you're outside of Brisbane, it's 1800 017 676. And I think you can, if you want to find out more about the cervical renewal on the Commonwealth Government website, is www.cancerscreening.gov.au. And I think that's about it.
Yeah.
So thank you, everyone.